I assist in patient handling at long-term care facilities for people with dementia and starting to diminish in their mental capacity and physical abilities. Essentially, it gets hard for them to move around. It gets hard for them to use the washroom and do the things they need to just in everyday life. So the products we assist in providing for them is essentially giving them the ability to get up, move around, socialize still, and have a sense of still having life to them and the ability to just be with other people.
Okay.
When we're speaking to a patient, there's guidelines we have to go through, and we don't do a lot of communication with patients, but it does come up just due to the nature. We're in their rooms, we're around them. When those situations come up, we try to treat them as humanely as possible, essentially, and they do have a bit of anger issues sometimes, depending on what they've gone through and essentially who they are and how the dementia affects them. So we try to be patient with them. We try to give them respect and the ability to just have a conversation. We try to treat them like people, which they are. There's 3 different types of lifts essentially we install or provide. There is a passive lift, also known as a Hoyer, which looks like a crane essentially. It has a arced arm at the top, and there's a sling attached to it. The slings have different purposes, and whether they're just going into a wheelchair so they can be pushed around, or going to the washroom, going to the bath. There's a sit to stand, which is more so for mobile patients. It essentially just helps them stand up. There's a shin guard, just helps them lift up, and then a overhead lift, which is more extreme cases. It will be on a track on the ceiling and come down, help them up, and bring them to whatever mode of transportation the nurse or PSW decides to use for said patient. It's really hard to say. With dementia, it can affect you super young. I've dealt with 35-year-old patients in long-term care facilities with dementia, and it progresses. Your brain functions, what it's capable of, what you're capable of thinking and processing. They change throughout the time, and it also has a lot to do with the physical injuries that your body has gone through over the years. They start to progress and become more evident as you become older. So yeah, it's patient to patient basis, and anger is a huge issue. Dementia patients, the main thing with them is they get confused. They don't know where they are. They don't know who they're speaking to. Imagine not knowing who you are and being in a place you don't know, in an environment you don't understand. And so when they get upset about something, it's going to progress. It's going to get worse and worse and worse. So you have to know how to deal with them. Most of the time we're told to ignore them.
If they're like really angry at you?
If they start getting angry, it can cause acts of violence. If you say the wrong thing. That being said, depending on the patient, if you know them, because as many facilities as I go to, I do get to know the people in the facilities and the patients there.
What's it like getting to know someone with just like a disorder like dementia? It's probably pretty difficult because they it affects your memory super, like, in very significant ways, right? Do they remember your face, or?
Not normally. I tend personally to just be soft-spoken, gentle with them. It can be very hard because you do start to know the patients, their
so
triggers.
It's more that you know who they are than they know who you are.
Exactly.
Okay.
So a lot of the times I'll go into a facility, and it's really good to use their names so they understand that you know who they are. Mm-hmm. And it's essentially, I'm not dealing with the patient physically. I can interact with them, and I choose to. Some people don't. I like to, just because I have a heart for. Exactly, I have a heart. They don't know what I'm doing there. Sometimes I can just be checking the lift. Sometimes I'll be doing a yearly inspection on it, making sure it's proper for them. Sometimes I'll be having a meeting in the room and just describing better ways for the maintenance or the staff themselves to actually be using the lift and ways we can change that. Yes.
Anyway, Nathaniel, it's been a pleasure interviewing you.
It's been great, Chris. Thank you very much.
Good.